Good afternoon, I'm Milton Walker with the Midday News. A special welcome if you're watching on onespotmedia.com. Health Minister Dr. Christopher Tufton says clinicians are now recommending using rapid test kits in detected COVID-19 cases. The rapid test produces results in 15 minutes.
The health minister says the view of doctors have changed from the earlier perception of the test not being necessary and as foolproof as the PCR tests currently being used. He was responding to calls from the Jamaica Hotel and Tourist Association, JHTA, and experts in the medical fraternity for the health authorities to expand their COVID-19 evaluation regime. JHTA President Omar Robinson says this will allow for a faster turnaround time for results for travellers. Speaking today on the morning agenda on Power 106 FM, Dr. Tufton said that the assessment of the most accurate rapid antigen test kit has started.
Now that we have the community transmission, there is value in using that approach, and we are now assessing because there are so many tests out there. Many of them are experimental, many of them are not validated by the respective agencies, and many of them have significant margins of error. And the authorities would like to put, or if they approve any, that would give greater guarantees. So it is a matter of time. It will happen. We just have to find the right tests and the right protocols around testing.
In the meantime, Dr. Tufton says at least one private lab has now been accredited by the Ministry of Health to do tests for COVID-19.
I think there's one now that is able to do so, and there are one or two others. So we would like to see more, because it certainly would take the burden off the stresses of the government institutions, and there is a market there that is willing to pay for these tests.
O'Shane Masters, TVJ News.
Professor of Public Health at the Mono campus of the University of the West Indies, Dr. Peter Figueroa, wants the government to enforce tighter restrictions as the country continues to experience community transmission of the coronavirus. On Monday, the government announced that the nightly curfews would start at 8 o'clock, while social gatherings will be reduced to 15 people down from 20. But Dr. Figueroa says those measures do not go far enough.
I have to commend the Prime Minister for increasing the curfew, but I personally would have proposed that he just take it to 7 o'clock. I would have reduced the crowds to even 10. Several countries in Europe, when they were having the surge, they went down to 5. And you could have 2 households together and 5 people. But because you see, what you're trying to do is reduce the interaction between people that is not essential.
He says tough measures are needed at this stage to ensure the surge does not get out of control.
It's better to go hard early, and if things are not as bad as you think, you can ease off. You go too soft and the surge increases more. And the danger of community spread and the surge is you get an increase in cases, both symptomatic cases and asymptomatic. You start to get an increase in severe cases, and you get an increase in deaths. If you look at deaths that we're starting from March, it's in the last couple weeks that we've been seeing an acceleration in deaths. Now, if the epidemic is a week or two ahead of us, then we can expect more severe cases and more deaths.
2 more persons have died from the coronavirus in Jamaica, pushing the total number of deaths to 36. The 2 deaths were formerly under investigation. They include a 77-year-old woman and a 61-year-old man, both from St. Catherine. The 2 had a number of illnesses such as diabetes, renal disease, hypertension and high cholesterol. Meanwhile, in the last 24 hours, there are 140 new positive COVID-19 cases, pushing the overall total to 3,323. The new positives include 78 females and 58 males from 2 to 90 years old. 39 of the cases are from Kingston and St. Andrew, 37 from St. Catherine, 28 from Manchester, 16 from St. James, Portland, 10 from Trelawney, 3 from St. Thomas, 2 and 1 case from St. Anne, St. Mary, St. Elizabeth, Clarendon and Westmoreland, respectively. There are currently 18 active cases, including 25 who are moderately ill and 8 who are critically ill. The latest statistics on confirmed COVID-19 cases in Latin America and the Caribbean show that they continue to increase. According to Johns Hopkins Coronavirus Resource Center, Brazil has the highest number of confirmed COVID-19 cases with a record 4.17 million cases. The Dominican Republic has the most confirmed cases among Caribbean countries with 100,000. Haiti and Suriname have 8,362 and 4,419 cases respectively, while Cuba has 4,377 cases. Jamaica currently stands at 3,323, the Bahamas 2,659, Aruba 2,589, Trinidad and Tobago 2,391. Guyana has 1,613 cases, while Belize has recorded 1,361 cases. Guadeloupe also has 1,363 cases. Other countries in the region with confirmed COVID-19 cases are Martinique with 754, Turks and Caicos 614, St. Martin 527, Saint Martin 239, Cayman Islands 205, Barbados 180, Bermuda 175. Countries which have recorded less than 100 cases include Antigua and Barbuda with 95, St. Vincent and the Grenadines 62, St. Lucia 26, Dominica and Grenada 24 each, St. Kitts and Nevis with 17, Montserrat 13 and Anguilla with only 3 cases. The Jamaica Manufacturers and Exporters Association, the JMEA, is warning that the COVID-19 spike could cause disruptions at some of the island's major manufacturing companies. The JMEA President, Richard Pandoik, complained that COVID test results delays have forced manufacturers to make special housing arrangements for key members of staff to ensure their factories continue to operate.
I cannot understand why the Ministry of Health continues to be the only one who seems to be intent on doing testing when they have so much resources and other people that are able to come on board, because in fighting this virus and fighting this thing, it has to be underpinned by rapid testing, isolation, and so we can move on. I mean, right now we have people in the manufacturing sector, waiting for a long time for tests, waiting for a long time for results. We can't. I mean, at the rate we're going to shut down sector because we won't have people available. So it's very important that we expand the testing to include the private sector.
He warned that the present situation threatens the country's food security. We take a break now on the Midday News. We'll be right back. Welcome back, continuing the news. A study by the National Secondary Students' Council reveals that 50% of students who sat the 2019-2020 Caribbean Secondary Examination Certificate (CSEC) examination did not complete their school syllabus. NSSC Public Relations Officer Rihanna Robinson made the claim during the UNICEF and the Caribbean Policy Research Institute (CAPRI) virtual press briefing yesterday. However, it's not clear how the students' performance were affected.
64.7% of students, as at May 17, 2020, had not been in contact with their schools and teachers to finish their syllabus for their respective subjects. And we must take into consideration that this was 2 months after schools had closed. Whilst this was a challenge, the level of effectiveness and interactive nature of the physical classroom in comparison to the virtual classroom had declined.
She stressed that the pandemic also underscored the challenges of internet access, particularly among poor students and those in rural areas. However, she says students have been able to adapt to virtual learning platforms even quicker than teachers, and in some instances have created online businesses such as vlogging. On another downside of the pandemic, though, Ms. Robinson says there has been a severe decline in students' mental health.
Extensive uncertainties that came with the lack of structure in the teaching and learning process, especially during the external examination period, as well as depression due to reduced physical contact with the outside world. Sleep patterns were also tremendously affected, and this would have also contributed to the decline of students' mental health.
And here's a preview of what's coming up in this evening's Health Report.
In the next edition of the Health Report, we'll look at men's health and COVID-19.
There are other studies that have come out looking at that in terms of data from Europe, data from the Dominican Republic, which suggests that though the ratio of men and women diagnosed is almost 1-to-1, the death rate is a little bit more in men. Now, I will say we have to be very, very cautious when we interpret these results, because maybe only 40% of the countries that report their COVID cases to the WHO actually disaggregate the data based on gender. But that being said, some of the countries that have reported their data do suggest that men are more likely to die from the disease. So a lot of people have now been speculating.
That's the Health Report this evening in Primetime News. And now for today's healthy living tip. Have regular checkups even if you feel okay. Schedule an appointment with your doctor when something doesn't seem right. Know your family history and share it with your doctor. Get some exercise and eat a healthy diet.
In sports, a courtroom battle looms between former President Dave Cameron and the Cricket West Indies as Cameron has applied for a pre-trial discovery of a copy of the internal audit done by Panel Carr Foster and commissioned by the governing body last year. We have more in this report.
It is well documented that Dave Cameron, who served 3 terms as CWI president, has signaled his intention to run for the chairmanship of the ICC. CWI Vice President Dr. Kishore Shala noted that if it was left up to him, he would not support Cameron. But over the weekend, Pakistan Cricket Board President Ihsan Mani suggested it's best the chairman comes from outside India, Australia and England. On Hits 92 FM Sports Grill on Monday, President Ricky Skerritt was quizzed about Cameron's quest and provided this response.
Unable to make any comment of anything that has anything to do with the past president of Cricket West Indies, because the past president has undertaken certain legal actions a few weeks ago, which is before the Antigua court at the moment. And so therefore my ability to comment on anything to do with him can compromise our defense.
Cameron's attorney, Tony Astafan, said the internal audit done by CWI has been leaked to everyone except his client.
So they're using this report in a way that we think is manifestly unfair and extraordinarily unfair, because it denies Dave Cameron the right to see this report and to respond to it in full. And what is of concern to us in particular was that Cricket West Indies had an internal and external auditor for years, and none of them were involved in this Panel Carr Foster report. More than that, a number of directors have made it fairly clear that they were not consulted or they were not interviewed.
Astafan says stories from the document could destroy the credibility of his client with baseless information.
Because Mr. Skerritt and his board and management made a decision not to make a full copy available to Dave Cameron, even though they knew that others in the media were given a copy of the report, by whom I say I don't know. And they were using it as a sort of Democles to write some very insidious matters about Mr. Cameron. And it is unfortunate that in the 2020 that a man has to go to court to get a document to defend his reputation against allegations that, to the extent that he knows them from the public and from the media, he has denied them absolutely.
And that's Midday News. I'm Milton Walker. Join us at 7 for Primetime News on behalf of the news, sports and production teams. Have a very good afternoon.